Good afternoon, everyone, and welcome to today's webinar. It's great to see so many people here. We've got a record number of registrations and we're really pleased to see that. I'm Anna from the TEC and I'm joined by three fantastic guests, Shelly, Tracy and Dele, and I'll be introducing them a little bit more in a second, but just first off, a little bit of housekeeping. We do have live captions on today's webinar. Underneath the video screen, there's a green button that says Open Live Transcript. If you click that, you'll get live captions that will open in another window. You can see the chat panel on the right hand side, and it's fantastic to see so many of you already introducing yourselves and telling us where you're from and your union. We always love to see that. And also, if you've got any ideas or tips, please exchange them there. We are recording this session, so if you miss any or you've got to leave early, please don't worry, and we'll send you a link to the recording later today, and it will be available on our YouTube channel. We'll also send a list of any resources to everyone who's registered. If you've got a question for our panel, there's at the bottom of the screen, there's an Ask a Question panel. Please post your questions there. We'll do our best to answer as many of them as we can. We probably won't get to all of them because there's a lot already, but we'll do our best. Right, so as I said, we've got three great panelists today. Shelly, my colleague at the TEC, Tracy from PCS and Dele from the GMB. And we're going to be talking about the lifting of Covid-19 restrictions. Now, we know that the lifting of restrictions is at a slightly different pace across the country. It's different in England, Wales, Scotland and Northern Ireland, but we're going to be talking generally here about what these lifting of restrictions mean. Even though we're all at a different pace, the advice and the guidance from us and the role of the trade union rep doesn't really differ. I will be covering what reps can do in these situations. So first of all, I've got a question for Shelly. What should reps do where employers are now saying that the COVID measures are no longer a legal requirement? So therefore, we're going to remove them from our standard risk assessments. Over to you, Shelly.
Thanks, Anna, and hi, everybody. Thanks for joining us today. I'm Shelly Asquith. I'm the National Health and Safety Policy Officer at the TUC. So there's a real risk that employers will be using this easing of government lockdown restrictions. And as Anna said, in England, it was the 19th of July. In Wales and Scotland, it will be the 7th and the 9th of August, respectively. They're going to be using this as an excuse, potentially, to start rolling back on workplace safety measures that we've been relying on to keep us safe from COVID transmission. Now, there may be instances where that's appropriate, fine, but our message is not without the union say so. So while there may no longer be sort of a legal requirement for us to wear face coverings in shops, for example, or to keep a 2-metre distance, there is still a legal requirement for employers to manage the risk of COVID transmission and to consult with the union safety reps, where your union's recognised, on any changes made to risk assessments and to safety management in your workplace. So while certain things may no longer be a legal requirement, if these are part of the measures identified in your risk assessment to help reduce the risk of transmission, then they should remain in place. In general, risk reduction should continue to follow the hierarchy of controls model, so layering controls. Employers begin by eliminating the possibility of transmission, using engineering controls, changing job roles, adjusting the environment. Personal protective equipment is a last resort because it's the least effective. And there's also a greater need to prioritise improving airflow indoors. And that's one thing the government has made clearer this time round. And that is a key step to reducing the risk of transmission. COVID aerosols are more likely to build up over time in indoor, poorly ventilated spaces. So employers are encouraged to purchase CO2 monitors, for example, to help identify those spaces, as well as opening windows and switching off recirculation systems, upper room UV disinfection, mobile filtration units, are additional tools that can be used. We previously did a webinar on ventilation, which you can watch back for a bit more of a sort of thorough overview of that as a safety measure, but that's certainly something that employees need to be improving in their risk assessment, let alone watering things down. Now, the TUC's response when the government issued its new safety guidance for workplaces in England, it was just 2 days before restrictions were due to end. We said that these guidance, it's a recipe for chaos and rising infections. It was rushed, inadequate, it posed real problems for worker involvement, never mind safety. Thankfully, the Welsh Government is consulting with unions and has sent us its draft guidance for feedback yesterday. So there is better practice elsewhere in Britain. But there's still a heightened risk, for example, for the clinically extremely vulnerable. There's about 500,000 people who are in work who are classed in that category, still at heightened risk from complications if they were to catch COVID. And of course, long COVID. We talked a lot about this before in previous webinars as well. That's a serious concern for the whole working population. Around a third of patients saying that their symptoms for long COVID are lasting up to a year. So this isn't about opposing reopening. We all want the economy to reopen, but only a safely managed transition out of lockdown will protect health, the economy, and of course the NHS. Now, the World Health Organization said a premature and poorly planned reopening of workplaces is likely to increase the risk of outbreaks at work. Unfortunately, that is what is now going on here. And we're now seeing tens of thousands of daily infections and the same number of outbreaks in workplaces as we had at January this year, when we saw the highest since the pandemic began. And last week was the end of the school term, the school summer term in England. There were as many outbreaks in care homes as there were in schools. So we're now seeing care homes kind of catching up with those number of outbreaks. It's really worrying. And despite our expertise, the government failed to consult unions or employer groups for that matter. So on the ground, in the workplace, it is up to us. It is up to you guys. Unions have to be assertive in ensuring there's no cutting corners on safety. There's no rolling back of safety measures without the union say so. Ensuring that employers are engaging you as the safety reps on any changes that are made to risk assessments. That may involve you calling a meeting of members, finding out people's concerns, talking to members about potential action you might need to take where that's happening. And if you determine that an employer's plans are putting people at risk, your union will back you. Covid-19 hasn't gone anywhere, so neither should the measures keeping us safe at work.
Thanks, Shelley. That was a brilliant intro to the subject and covered lots of ground, and we'll definitely come back to you with some questions later on in the webinar. So my next question is for Tracy. As we said, Tracy is from PCS. So Tracy, PCS members at the DVLA and at BAYS have currently been in dispute with their employers and recently on strike about COVID issues. So what can reps learn from their example about taking action over COVID safety?
Yeah, thanks, Anna. I think there's a number of lessons that we can take from the action that's been taken by DVLA members in Swansea, as well as the other actions that our members are involved in, amongst security guards, cleaning staff and facilities management workers. And one of the key first lessons is that unless you have a strong union in your workplace, the chances of challenging management effectively and the chances of fighting for safer workplaces becomes harder. I think what the pandemic has also uncovered and shone a real spotlight on is the fact that things were really bad before the pandemic. I think the pandemic has brought into sharp focus how important health and safety and welfare is in the workplace and in that context. And I think that many workers now are being reintroduced, if you like, to health and safety law, health and safety rights. If we're being honest, as a movement, before the pandemic, a lot of us saw the role of the health and safety rep as something about, someone going round with a clipboard checking the plugs. And I think that now this year is obviously showing that health and safety is a major, massive issue. In the case of DVLA, which is the largest employer, one of the largest employers in South Wales, you read the headlines of it, and I think we're now up to over 640 positive cases have come from that one workplace. We've seen members being afraid to talk about it, that they're worried about bullying management. The fact that they're threatening outsourcing and all sorts, reflects poorly on not just the fact that the management there had a lack of disregard for the health and safety of our members who worked there before, because that agency, the DVLA, is an agency of the Department for Transport. It employs over 3,000 people in South Wales, around the Swansea area, but they would not take any responsibility for the fact that the COVID virus was their workplace was contributing towards the increased infection rates. And therefore having a knock-on effect into the community. There's been an absolute refusal from their part in order to do what's been necessary. But I tell you what's been absolutely incredible has been the support and the fight that has been shown by the members there, and it shows you how bad things were before. Because by the 12th of July, our members will have taken 37 days worth of strike action since when the dispute began earlier on this year. Anna's going to post in a very good link to the recent evidence that was given to the Transport Select Committee on the 21st of July. And if you look at that really goes into the detail. It's Mark Swatker, General Secretary, and Sarah Evans, who's the lead trade union rep there, give you the in-depth evidence in terms of what's actually taking place at that workplace. But the resolve of the members has been incredible. The dispute continues, but it's actually developing into a dispute about the fact that it's not safe. In general, we want long-term staffing and working hours agreements and all sorts of I think that workers have got to the stage where they're fed up working in the conditions that they're working on, and there's a big fight that still continues to be made. The DVLA, most senior civil servants in the civil service are scratching their heads really at how bad the DVLA itself has actually managed the situation. It's a legacy of lack of investment in IT equipment. It's a culture of not trusting the operational staff, the more junior grade staff, if you like, to work from home when all of that could have been possible. So the fight goes on, and there's many lessons to be learned from that dispute. And I think that once we when we ever do get to the stage where there's a public inquiry into all of this, I think that the DVLA example will be up there front and centre. So there's going to be a fresh ballot for industrial action in September and more targeted action to follow. Also, in addition to that, our members who work in facilities management, who work for the Department for Business, who are employed by contractor ISS, took 3 days of strike action last week. Our members at the Royal Parks, who are park attendants, some of the lowest paid privatised workers attending our Royal Parks are taking strike action for the first time against outsourcing this Friday. And again, we'll post a link in the chat about that. But just to say on the issue of facilities management and cleaning staff taking action, they've been obviously some of the worst affected in terms of the conditions that they've had to work through during the pandemic, with the lack of sick pay, lack of health and safety measures. I think is very encouraging to see that there are so many actions of this kind taking place. It's going to be the first time we've taken joint action with the UVW trade union, and the message is getting round there. We have a number of our PCS reps and members who work in cleaning and facilities management from museums and galleries across London who are going to be attending that picket on Friday. But I think one of the key messages that we've got to take away from the past year is to say, well, look, we've learnt so much. we've kind of, refound ourselves again in terms of, health and safety. And I think what we need to do is, now that we know that the government are abandoning any sort of pretense of making our workplaces safe, that employers will be allowed to kind of, adapt their guidance. If there's no oversight, if there's no enforcement, then the trade union movement itself has got to take that into their own hands, and we've got to think about how we develop, networks of safety reps that can, provide, a support mechanism for other reps, so that we get in there, we unionise workplaces, we fight for national standards on health and safety, and we bring the union back into the workplace, really using the examples that we've had over the past year.
Thanks so much, Tracy. And I think you make a really important point there about how throughout the past 16 months, the image of health and safety, of the health and safety rep, has really changed, hasn't it? Like you said, they're not going around checking plugs so much anymore. It's brought health and safety to the front and centre, really, of workplaces and the union role, and that's a good thing. So I'm delighted now to move on to Dele. We lost him there for a minute, but he's back, and that's fantastic. And not only is Dele from the GMB Southern region, he is also one of the nominees for the TUC's Health and Safety Rep of the Year. So we're really pleased to have him here today. So, question for you, Dele. Can you tell us about, in your workplace, how you got other union members mobilised around safety concerns, and then what was the outcome, please? Over to you.
My name is Dele. I'm from the GMB Southern region. We go back just over 18 months now. GMB came over to our sites and started to ask us to join up. They expressed interest in our company because so many people had complained about processes and procedure that had been taking place on site. Health and safety, as well as workplace organizer issues. We joined hands with GMB, and we spoke to our colleagues, encouraged them to join up, explained the benefits of joining up to them, and just basically tried to get them to understand that collective action actually works. As time went on, we managed to hit the 50% mark, whereby the union, and we would be able to become unionized. We hit our first brick wall. Once that happened, the company said, look, we don't recognize a union here. We're not going to let the union in. And fortunately for us, the union thought it was worth fighting for, took it to court. The case went to court. It was quite a nasty case. GMB obviously won. We then had a further vote in terms of, so we were then allowed to vote whether the union should come in or not. The company quite aggressively campaigned against this. They called us into numerous meetings and said, look, we are saying to you, we don't want the union here. Don't vote for the union to come in. They started to offer us concessions, incentives here and there, saying, look, we've done this now. Those areas that you were complaining about, they've been addressed. There's no need for a union here. We could see right through that, and we continue to campaign on behalf of the union. We continue to campaign in support of getting a union in, basically speaking to our new starters, speaking to people who we knew didn't have a voice, people who had been basically mistreated. Before we got unionized, health and safety was quite frankly a bit of a joke. We would go to management and we would express our concerns about working practices that we knew were not safe. We would highlight areas within the risk assessments that were not being followed. Would go to senior management, speak to them as well, all falling on deaf ears. Eventually, once the union was in, we continued campaigning, speaking to our colleagues at work, urging them to join the union. We started to get our numbers up. and we immediately started to gain wins. We celebrated those wins by making sure that we went back to our colleagues who hadn't joined, telling them that look what we've done, look at the changes we've made. These were massive changes. I'll give you an example. We really didn't have any health and safety process in place. We had no health and safety committee, where we should have had committee meetings at least once every 3 months. That was all being ignored. Near misses were being ignored. We had no near miss reporting system in place. A load of things like that. But just to give you an idea, there was someone who almost had an accident on a truck. She almost ran into someone. She reported it to the line manager and said, look, this should have gone down as a near miss. There aren't any near miss forms. The manager said, don't worry about it. I'll deal with it. Leave it to me. It went away. No one heard anything back. So as GMB came in, we started to challenge things. With the help of our senior officer, along with our health and safety lead, I believe we were able to get into a situation whereby, we could challenge things directly with senior management, i.e. the operations director. We set up a health and safety committee, not once every 3 months, it was actually monthly. And then we would always go in there with a list of issues that we had and queries. As time went on, not long after we became unionized, COVID hit. Now, this is where it got interesting, because the company, bear in mind, this is a company used, Net-a-Porter, short for YNAP. They sell £40,000 handbags, high-end luxury. They weren't willing to stop a 24-hour process to make the place COVID secure. We kept using the terms, the place needs to be COVID happy. We need to get walkways in place. Sanitizer stations need to be in place. We need to have masks readily available and stuff like that. It all fell on deaf ears. And this is the bit where I would say it becomes a bit empowering, because we didn't have it easy. We ran into brick walls all the way through the process. It continued to fall on deaf ears, and we continued to try to negotiate with management, trying to look for a win-win situation. We weren't getting much joy. We went to senior management, we went external to head office. We're getting a couple of concessions here and there. They were saying that, look, we're trying to see how we can stop the operation for a couple of hours here and there to put COVID measures in place. This all took place over a period of about 2 weeks. In the end, obviously, working collectively with our members, senior officers, we decided to look at our options. We knew that we could take collective action, i.e., collective grievance, sign petitions, but we also knew that we could go public, and we knew that if we'd gone public, we would highlight all of the things that the company was doing. This is a company that depends on its reputation. Our customers are the likes of Elton John, A-list stars. These people don't want to hear that companies mistreating its staff. So what we decided to do was that we decided to warn the company that we've gotten together, we're mobilized now, and we're going to take action if you don't listen to us. Once again, fell on deaf ears. So they called our bluff. We took action. We went public. We put out, newsletters. We went to rating bodies that rate companies like ours. Eventually, YNAP kind of became a little bit discredited. Their rating went down with one or two of the companies. Our parent company got wind of that. So all of a sudden, people were noticing us. The owner of our company, who's from our parent company, decided to get in touch and say, look, what's happening? What's going on? I'm hearing all this stuff. Most of this stuff wasn't fed back to me before. In a shorter version of the story, he decided to shut the place down for 30 days. Now, remember, we were asking for a couple of days, probably 2 or 3 days, to get the place COVID secure. All we really wanted was walkways, sanitizer masks, probably situations whereby people could be individually assessed in terms of whether they were vulnerable, looking at occupational health in terms of people that might need to be off work if it wasn't safe for them to come into work. They shut down for 30 days. I wouldn't say that we got a good response from the company itself. We were nicknamed the infamous five. There were 5 of us reps. They spread a lot of news about us saying that, oh, that we're just troublemakers. We've collaborated and shut the place down. We've shut a multi-billion-pound company down. Richmond got back to them and said to them that until they negotiate with us terms and conditions whereby we can guarantee the safety of staff, the place is not going to reopen. And he made it very clear that the safety of everyone was his priority. You know, it was almost like magic. The company started to dance to our tune. We became their best friends. We've been called into all kinds of meetings with global directors. We've been asked for our opinion. They were asking us if we could do joint comms to go out with staff. And what they then did was that they set up risk assessments with safe systems of work documents to train out staff. They told us that they wouldn't make a move without our involvement, without our acceptance of these reports. So we started to work collaboratively with the company. To cut a long story short, we now have thermal imagery cameras everywhere. In terms of our access, ingress, and egress, we've got separate walkways. We've got a separate entry from an exit, and everything. I mean, I would say half of the capacity of our 4 warehouses within our DC has been taken out. So we've got social distancing, 2 meters. People are handed sanitizer packs, masks, gloves, everything as they walk in. Everything's readily available. I mean, you couldn't make it up. I can't think of anything that they didn't do. I mean, including split screens. There's split screens on every single desk. I would say it's probably one of the most secure environments that you can imagine. I mean, I honestly wish I could take pictures and show you, but I can't. But this all came off the back of us having to collectively take action against the company. We mobilized all of our members. Now, the one piece of advice that I would like to give is that recruitment and organizing are 2 very important tools. You might ask, what's that got to do with health and safety? Well, we had those numbers behind us. We celebrated our wins. Whenever we had a win in favor of our members, we would relay that back not only to our members, we'll say to people who are not members that look what we've done. We've got this going. If we can increase our numbers, we can get more wins. You know, it will benefit everyone. Right now, we have a situation where we've gone from a place where, as I said earlier, health and safety was a complete joke. Health and safety now has the respect it deserves. Management are not only listening to us, they are consulting with us. They are communicating with us and asking us what we think, saying to us, look, we have this idea. What do you guys think? They're not implementing anything without our consent, without us saying, look, okay, we're happy with that. We're able to speak to our members and say, what do you guys think about that? You know, we're able to go back to management and say, look, we'll make these recommendations, or maybe we should hold back on that. I'll give you an example of what's happening right now, since obviously in England, restrictions have been eased. They've said, oh, no masks, everything's opening up. I can tell you that with YNAB, everything that was in place before the COVID restrictions were eased is still in place now. You know, mask wearing is still in place. People who are vulnerable are being assessed on an individual basis, you know, through occupational health. We've got sanitizer stations. Everything is literally still in place. Even the walkways, the thermal imagery cameras are all still operational. I'm not saying that that would be possible in every company, but there's certainly a way forward in terms of a win-win, a situation whereby you can get management to actually listen to you if you're able to mobilize, if you're able to get people to collaborate, members to collaborate, increase your number levels, and properly organize in a situation whereby you don't start losing members because you're not actually organizing properly. other than that, I would say that there are a lot of avenues through which you can negotiate with management as well. You know, we've got the TUC handbook, which is a fantastic piece of equipment that you can use. You know, we've got the Health and Safety legislation, the Health and Safety Act 1974, Section 2 explains the duty of care that the company has got towards staff. So it's not about government legislation. It's not about government easing restrictions. It's more to do with the duty of care that the company has got towards you. They can't say to you, because government have eased restrictions, we're going to open everything up, regardless of the fact that we have numerous people that are immunocompromised, vaccination rates are very low, infection rates are high within the company. They can't just say that to you. There has to be a risk assessment that determines what is safe and what isn't. So I hope this helps. And yeah, I mean, let's keep flying that flag.
Absolutely, Dele. That is was the most inspiring story, really. Not that it's a story, it's real. Your experience is invaluable, and I don't know whether you can see the chat, but people are all congratulating you, saying what a great situation it is to hear about. And to quote one viewer, "This is sick, Dele, love it." So absolutely, that's the best comment I think we've had so far. Right, so we've had quite a lot of questions posted already, and I'm going to try and get through as many of them as we can. But the first question that has come from you, from the audience, is for Shelly. So Shelly, we've had it's the most popular question so far, and it asks, what if people aren't confident in going back? Do they have the option to remain working from home? Obviously, if that is possible in their sector, because they say as a workplace is only as COVID safe as the people who are there.
Yep, great question. I spotted that one. So, I mean, essentially, an employer can tell you to go back. The official guidance now says that there's no recommendation to work from home if you can. And there's not sort of a legal right to say no, unless, of course, you can demonstrate that there's a serious or imminent threat to your health and safety as per Section 44. But you do have power. And I think Dele's given no better example of that. You know, the union can choose to negotiate an alternative to everybody going back to the workplace, whether that's a long-term solution of flexible hybrid working, or it might be a short-term negotiation for working from home for the most vulnerable workers, for those who feel anxious about going back, to keep people working from home for the foreseeable future where there are safety concerns or other issues. And certainly, you know, as we've already covered, there should be no quick unraveling of risk assessments and safety measures. That includes, you know, suddenly telling everybody to go back to the workplace. Certainly the union needs to see what measures are going to be in place before people do start going back, especially if you know, the employer is proposing that everybody goes back all at once. And ultimately, you know, the union should be meeting people who should be airing their concerns and discussing about what kind of action you can take over those demands. You know, there'll be some people who want to get back into the workplace, and that's absolutely fine. They might not have sort of suitable health and safety, good working conditions at home. But ultimately, a lot of people are concerned about going back to the workplace, and with infections at the height that they are, with the impact of long COVID on a lot of people, rightly so. I just want to say quickly, though, in particular about shielding workers or those who are considered clinically extremely vulnerable, because I know we've had a few questions about that, and obviously there'll be particular concerns for those members about going back to the workplace, and it's absolutely outrageous the way that the government has handled the advice for those workers, actually, because on the 16th of July, the guidance for workplaces in England was published. And it said to employers to look at the specific advice for protecting vulnerable people, the CEV guidance. And at that time, it still said that those people should be working from home if they can. So essentially, that order to no longer work from home didn't apply to those people who are still at particular risk from COVID. A lot of them have health conditions or take medication that means the vaccines are less effective as well. So that's obviously a serious concern. But on the 19th of July, on the day that officially those guidelines came into effect, that bit was taken out of the CEV guidance. So those particular workers, and I said earlier, there's about 500,000 people that this applies to, are no longer advised to work from home. Now, our position is those people should continue working from home. Unions should be negotiating urgently to ensure that that remains the case. Any good employer should be making those allowances for at least CEV people to continue working from home. But it might be that you'll come up against issues with this. I would say that to any of your members who are in that situation, to speak to their GP or consultant and get a letter to confirm that they are in that category, to confirm that there are still increased risk for those people if they're going on public transport, going into the workplace. They need to be adhering to really strict social distancing measures and using that in any kind of negotiation with management, because it's a serious concern for a lot of people, and people are at increased risk of exposure if they're going into work. Equally, there are people who've been told that they can't get the vaccine because of certain health conditions, whether or not they come into that CEV category. Again, getting a letter from the doctor, and also seeing if people can be referred to occupational health as well.
That's fantastic, Shelley. Thank you. The next question I'm gonna pose to Tracy because it maybe links to some of the things that she was talking about. There's quite a few people who have referred to this. How can union reps ensure that the risk of COVID is not forgotten? As we move forward, we know it's probably never going to go away, but how can reps in the workplace keep it front and centre, really, in the minds of both their members and the employer?
Yeah, another great question. And yeah, I mean, obviously, I don't think the risk of COVID is going to go away anytime quickly. I mean, as Shelley has alluded to, there's going to be a number of ongoing issues that are going to be flowing from it, not least the issue of long COVID and the health impacts that is going to come from that, as well as employers playing loose and hard in terms of trying to get workers to be exempted from pinging of the app, and you don't have to isolate anymore, and implementing measures that are really kind of putting our members at risk. So I think the health and safety risks around COVID, I think, will be around at least this year. But I think in terms of ensuring that we don't forget about it, we can never forget about the experience of the past year. And what the decisions that governments and employers have made that's affected workers' lives. We've heard so many stories, particularly the care sector and the NHS, of just absolutely atrocious, appalling conditions. So from that point of view, no one can really forget the events of over the past year. Not to mention the psychological impact that everything is going to have. All is not least stemming from our how our personal lives have changed. We might have experienced personal tragedy. But also as well, in terms of the world of work, I think just before the pandemic, I think the figure was something like 4% of the UK population were afforded the right to have the option to work from home. You fast forward a few months, and lo and behold, the technology is there. That 60% of the population can work from home. Now you think to yourself, well, that's great. There's loads of benefits that could come from that. Yes, that's if your employer is fair, and that's if your employer is operating it in a fair way. And as has been mentioned, we've got strong unions in the workplace. So for me, it's not really a case of not forgetting about COVID. It's about how do we draw on the experience of the past year, and a lot of the stuff that Dele's covered. How do we draw that? What have we learned from it? How do we consolidate our position in the workplace? So the trade union oversight that has been one in Dele's workplace, which the work for that began before the pandemic, didn't it? That continues, and it's not it takes us into the realms of, yes, we want safe workplaces in relation to better air quality. Ventilation was bad before. We were all going off with coughs and flus before because of bad ventilation and out of date HVAC systems. Let's look at that. Let's look at the fact that everybody's life has been turned upside down. Well, let's look at giving workers some control over having a say over their working practices. Let's have let's as Dele says, collectivise the common issues around here. And the key thing for me is consolidating. We can't really go back to the way we were before on health and safety. We can't really go back to the days when there's the health and safety rep going on about the legislation again and going on about the management regs, yawn. I think those days are numbered. But what we've got to do is we've got to then take that to the next level, consolidate where we are, build out from that, make links. I think building networks of trade unionists in local areas of health and safety reps from across unions, which could be organised on an area or geographical basis, would be a good shout. We could target certain particular sectors in the economy. So, for example, in Scotland, there's an organisation called the Call Centre Collective, and they've been doing a lot of work in Scotland around, COVID conditions, particularly non-recognised, call centres. It was the place where up in I think it was at the start of this year, a company called Teleperformance were wanting to introduce body cameras into your home workstation so that they could monitor you, film you all day while you were working from home, to make sure that you were actually working from home. The Call Centre Collective played a key role in embarrassing that company and getting that lifted. But we're still left with the issue that most workplaces don't have a health and safety rep. We have to look at union density, particularly in the private sector. But the framework is there, isn't it? The Brown Book, the Health and Safety at Work Act, management regulations, all the framework's there. It's just about how we then translate that into a kind of trade union, industrial context, if you like, bringing in all the points around, having members behind us. Very winnable. I think no one can argue that health and safety is not important. I don't think we'll have to, do the work that we might have had to have done before to convince members of that. So my view is build on the momentum and see how much we can build going forward.
Yeah, absolutely, Tracy. I think some really sage advice there. Shelly, isn't this the idea of the network of safety reps something you're already on the case with? Am I? Yeah. So we are on the case with that. I think that's a great idea. Another quick question for Shelly that's been posted. Any chance of us writing up a case study of Dele's situation and his success on our website? And I mean, it's already on the GMB website. We've posted the link to that, but absolutely we'll look into that for the TUC website, because I think the more people that hear about this, the better. Okay, I've got a question for Dele now. What advice have you got for other reps from your experience in obviously the success that you've had at Net-a-Porter? Have you got for specifically for the reps, not so much around the talking to management, negotiating, but how you strategized with your fellow reps, communicated, and also crucially, I think, looking after your own mental health and basically taking care of yourself and your fellow reps. Over to you, Dele.
Brilliant question. Can I first say that GMB on its own, they really look after us, and we've done 2 1-week mental health training course sessions. We have a senior officer that communicates with us very regularly. But going back to how reps can basically be their best, that's the way I would put it. It's obviously, I'll go back to what I said earlier, there's power in numbers. So, make yourself approachable. You don't have to know everything. As I said, there are a lot of sources of information that you can refer to. Going back to the 1974 Health and Safety Act, the TUC handbook, the ACAS guidance book, if something has to go further. So there are numerous avenues of information that you can source out. With regards to working collaboratively, I would say collective action is probably almost always the most efficient way to actually work. We all want to win-win. We want to get along with our bosses, but it isn't always the case. unfortunately, there are times whereby we have to go down that route, whereby we go into dispute, things get a bit ugly, and it's not so pleasant. So yeah, working together is how we got by. I mean, myself and my co-reps, we worked very closely together. We spoke to each other on a very, very regular basis, and we very regularly communicated with our members. We were almost like joined by the hip. We sang off the same hymn sheets, and when we presented ourselves to senior management, they can see that we were a collective force. We knew we were going to rise together or fall together. And obviously involving outside bodies was eventually how we got by. We didn't enjoy doing a press release. We didn't enjoy going to the likes of Sky News, BBC, and places like that. But if you look at the extent to which the company responded, I mean, how effective that was, if you could just believe in your position as a union member or a union rep, and you believe in the power of collective action, you will go places that you wouldn't be able to imagine. I mean, our story it's very inspiring in the sense that we did it the hard way. We didn't have it easy. Yeah.
Yeah. Thanks, Dele. Really inspirational, and lots of people, I think, in response to you, are also posting in the chat about what their union has been doing to support them. So it's great to hear. There's lots of links being shared as well, which is fantastic. Lots of resources, and we will include these in our email that we send out to all people who've registered for the webinar later today. So don't worry, you won't miss out on anything. We'll make sure they're all included. Okay, Shelly, another question for you. Our viewer asks, many members are now suffering from long COVID. Should employers be considering this in a similar way to other long-term illnesses, especially bearing in mind that it's still quite new and we don't know a lot about it?
Yes, in a word, they absolutely should be. I mean, again, it's something, as you say, we don't know a lot about. We're still waiting for sort of research to come about. But the TUC did a survey of more than 3,000 workers who've experienced long COVID quite recently. We found that a third of them have experienced symptoms up to a year. 50% more of them have experienced discrimination from their employer as a result of those symptoms. A lot of them saying that they're not being believed. So as much as we want employers to treat this as any other sort of long-term chronic health condition, it's clearly not happening. So there is a real need here for unions, for safety reps to be collectivizing this, to be raising issues, seeking some negotiation. Again, as I said before about people who are clinically extremely vulnerable, getting a doctor's letter can massively help somebody's personal case in terms of discrimination. So getting some kind of something written to kind of back up the fact that they are experiencing that illness. Also asking for people to be referred to occupational health for further backup in terms of that person's return to the workplace and what kind of reasonable adjustments need to be made to support them. But nationally, the TUC is calling for long COVID to be recognised as a disability, because that would give people sort of legal protection in terms of equalities. But certainly in the meantime, we need unions to be pushing hard on this to protect people with long COVID, to make sure that they're not forced back to the workplace early, and where they are comfortable going back, to make sure that reasonable adjustments are in place. A lot of the symptoms that people are experiencing, things like brain fog, fatigue, these are issues that can in turn cause other health and safety hazards in the workplace. If people aren't able to concentrate properly, if they're tired, there are certain things that might need to be done, like a slower transition into work, coming back part-time, doing hybrid working so they can work from home. All sorts of things might be available, but certainly it's something that we need to keep our eye on. Ask your members if they're experiencing this kind of symptoms and collectivise it as an issue.
Thanks, Shelly. And I'm going to pick up on that last point you mentioned there, because it relates to a question we've just had, which is about talking to members. One viewer has asked, what advice can you give, and question open to all, about the mode of communication, because they find that emails to members are often overlooked or missed. So in your experience, we'll go with you first, Tracy, but then I'll put it to you as well, Dele. What type of communication to members has worked for you?
Yes, good question. I think good communications would be the answer. I think that it's always, first of all, it's always got to be good and relevant content. I think a lot of people get bombarded quite a lot with, we all get, lots of spam emails all the time. We're always on our phone, and the best types of communications I find are the ones that have got the best content. They come out kind of on a regular basis, so you know when to look out for it, and that they then pique more questions than the aim of communications, in my view, is to kind of obviously influence or put forward a point of view, but also in the trade union context, it's also about how we can build up distribution lists and get people active. So I don't think it's a kind of one size fits all. I think what has worked particularly well over the past year, though, I would say, is doing kind of a lot of the kind of online Zoom meetings that we've had, where we have had quite well attended members meetings. I know that a lot of our branches have utilised that quite well. They've found that actually members are turning up, more members are turning up than they would have traditionally, and also as well for people who work in sort of not outside the traditional sort of public sector. I think WhatsApp groups work particularly well, and particularly people who don't have access to computers. So it's a very good question, but it's a kind of wide ranging one, and I sort of went on to there.
Absolutely, Tracy. Some good advice there, and I think you hit a really important point, is that as we've all had to meet online over the past 16 months, we are maybe more people are coming to these, more people are coming to online meetings, but I think we're hearing anecdotally as well that we are getting people who wouldn't normally be involved in the union are joining. We're reaching a new kind of member, not that they're new members, but previously they weren't so involved in the union and they're now joining, which of course is fantastic. So Dele, in your at Net-a-Porter, how did you communicate with your members? Did you use email? If you did, what worked? If you didn't, what did you use?
Yeah, we use email. We did news bulletins quite a lot. Obviously, things have changed since COVID hit, because before COVID, we did regular group meetings, like large group meetings. What we have now is we have socially distanced one-to-ones. One of the things that we realize is that when we gather people in larger groups, obviously socially distanced, not everyone wants to speak up. We've got people who are a little bit shy to speak, or they're concerned that people might think their questions aren't that good, which is obviously never the case. So we do have one-to-ones now. We encourage people to ring us on one-to-ones, to have a Zoom meeting with us, or a WhatsApp meeting. We're always readily available. We try our best to make ourselves as available as we possibly can. If something is urgent, people can reach us at any time, whether it's via email, text, or whether it's that they want to have a meeting. We do walk round tours, because obviously we're from the health and safety arm of things. Under our facility agreement, we can do site visits and walk round tours, during which we can speak to our staff members, to our members that are actually or have concerns of a certain nature, whereby they might not necessarily want to discuss it over a Zoom or Skype meeting. Our news bulletins have worked quite well. People have responded to them quite a lot. We try to keep them short. We know that not everybody will read them, so we make sure that we try to reach out to people that we don't hear from. For example, we did a survey recently on safety issues, because people weren't being properly reimbursed, and we did an email ballot, and people that we didn't hear from, we requested if we could have a quick chat with them in terms of, like, what do they think? What are their ideas? Trying to keep them engaged and encouraged. With the exception of that, as COVID eases, we'll see how things go. As was said earlier, COVID hasn't gone away, so we're going to continue to try to find new ways to reach out to people. For example, we've got this app that we want to take on now that translates languages. Where we work, we have about 20 different nationalities, something along those lines. So we want to be able to translate languages. In our news bulletins, we have them in about 5 different languages at the moment that we post up onto notice boards, areas where we know that people will see them. We also obviously have reps that we know can speak different languages. We're multicultural, so we're trying to look at all the barriers. It's a work in progress, yeah. But with regards to moving forward, we're looking to do more one-to-one and group sessions to get people engaged and to find out how people feel, really, get a temperature check.
Thanks again, Dele. Amazing work that you're doing with the GMB at Net-a-Porter. So we've been live for nearly an hour. We've had some fantastic information. So I think before we finish, I'm just going to ask each of you to sum up and just give everyone a positive message to finish on. So one quick thing: we've only answered a fraction of the questions. I know that we with popular webinar, we never are able to get through all of them, but please don't worry, because we do use the questions that you post on these webinars. We use it to inform advice that we put out at a later date, so they're not forgotten. We do make note of them all. So Shelly, some final words?
Yeah, I'm just going to quote back something that Dele said earlier, which was collective action is always the most effective strategy. If you believe in your power of collective action, you will be able to go places you wouldn't even imagine. I appreciate that most people on this call will already be a union rep, let alone a union member, but I just want to sort of emphasize that you are safer in a union. Tell that to all your workmates. TUC research during the pandemic has proven that workplaces with unions have better control measures in place to protect from transmission, has had fewer COVID outbreaks in those workplaces, and tend to have a better rate of sick pay. So if you haven't yet joined today, thank you everybody for tuning in, and thank you so much, Tracy, Dele and Anna.
Thanks, Shelly. Any last words from you, Tracy?
Yeah, thanks. I was really nervous about doing this at first because I'd never done a webinar one before, where you can't really see anyone. The only people you can see is the other 3 people. But it's been absolutely fantastic, and it's been a great experience. One of the things that sprung to my head was that sometimes the trade union movement has been has been working particularly hard this year. We've thousands of safety reps across hundreds of workplaces have played a key role, and we're all probably a bit burnt out now, with everything that's going on. But sometimes we must remember to collate our successes. We don't do it enough as a union, and I think that's one of the lessons that I took from today, is that we're going to kind of try and collate our successes a bit more, to make sure that then that message is getting out to members, to continue to share ideas and best practice. I think we're on the right track. I think that particularly the Hazards campaign as well has played a vital role in all of this, as well as these TUC webinars, where we're seeing networks of health and safety reps come together, grappling with really complex issues, often hostile management. So we continue to do that, build the union in the workplace, but also don't stop at building the union in the workplace. Let's not keep this to ourselves. We know that workplaces are safer when there's a strong union in there. So let's think about not keeping that knowledge and experience to ourselves, and how we can expand that out to the rest of the UK workforce who need a union at this moment in time. So that, thanks very much, Anna, Shelly and Dele. It's been fantastic.
And thank you, Tracy. And last but absolutely not least, Dele, some final words from you. You don't know whether you saw, because it's shot by in the chat, but someone has said, Dele, you're my new superhero. We need Dele Man in the Avengers series. So there you go. Over to you before we finish.
I'll just like to thank the audience. I mean, the comments you've put in there are so inspiring. It really lifts me up. And as a union rep, it makes me realize how worthy I am. I really thank you. I'm humbled by on all of your comments. I mean, it's a shame we couldn't get back to all of you. I wish we could, but thank you so much. To my panel, Shelly, Tracy, and I want to thank you. I really want to thank you. I'm happy we put this together and we could reach out to so many people. One advice that I would really like to pass through to you is to let you know that you are all great people. I mean, if you're not a union member, please join. If you are, whether it's a union member or a rep, you are one force. You're never alone. You're never ever going to be alone. I mean, we will fight together to make the workplace a much better place. We're changing the lives of millions of people by supporting them and protecting them. I come from a background whereby a workplace whereby bullying, sexism, homophobia, and racism was rife. All of that has gone away now. Those managers have been given their, they've been given their marching orders. They've literally been fired. We've highlighted their issues, and now the tables have turned. They're watching over their backs now. All the crooked managers, and so thank you very much. And please, let's keep pushing forward. Let's be one united front, and we will rise together. Thank you.
Absolutely, thank you, Dele. And so it just remains for me to thank all of you for tuning in. You've been a fantastic audience. Some great questions, great interaction, and thank you again to Tracy, Dele, and to Shelly. We'll see you again soon for more webinars and more great exchanges of ideas. See you soon, everyone. Bye bye for now.